We are very pleased to announce that the results of the first 6 years of Australia's National Preterm Birth Prevention Program have been published in Lancet Obstetrics, Gynaecology and Women's Health. Lancet is one of the world's leading medical journals, and we are very pleased that the Australian program has found a home in this very important publication. On a very personal note, I would like to thank the Australian of the Year Awards program and Aspire. I was very fortunate to be the 2020 Senior Australian of the Year. My goal in that year was to find ways by which we could further spread this national program effectively across Australia. I truly believe that the Australian of the Year program, which is a very unique Australian thing, provides certain individuals with a great privilege and opportunity to pursue their passion. And for me, that has certainly been the case. This publication in Lancet is really dedicated to the Australian of the Year program, without which I believe it would not have happened. Preterm birth is defined as birth before 37 completed weeks of pregnancy, and in Australia, after 20 completed weeks of pregnancy. Preterm birth is the single greatest cause of death in young children and one of the major causes of lifelong disability. We now know that it should never have been 37 weeks, and many babies are not mature until 39 weeks. So we call the period between 37 and 39 weeks, those 14 days, as early term birth. The rates of early term birth have been rising dramatically in Australia and similar countries, such that 1 in 3 Australians are born in that 2-week period. A major strategy of ours has been to lower the rate of early term birth as well as preterm birth. The Australian National Program really began in 2014 in the state of Western Australia, when we introduced a package of 7 clinical strategies and found very quickly that we had effectively reduced the rate of preterm birth at a population level. That led in 2018 to Commonwealth funding for us to found the Australian Preterm Birth Prevention Alliance. Over the following 3 years, clinical leaders from across Australia embedded these strategies in their hospitals and in their clinical practices, and that was coupled with a very active print and social media campaign. During that phase, we lowered Australia's preterm birth rate by about 6.5%, which amounts to about 1,700 cases being prevented each year. The savings of that to the federal government would be at least $100 million on an annual basis. In the next 3 years, which ran from 2021 to 2024, we added a breakthrough collaborative. That is a methodology by which a large number of hospitals are selected and included. And in those hospitals, we showed that we had not only maintained the reduction in preterm birth prevention that we had shown previously, but we now had prevented a lot of cases of early term birth. That is birth between 37 and 39 weeks gestation, which is a major predisposing risk factor for behavioural and learning problems at school age. That reduction was about 10% and amounts to about 5,500 cases of early term birth that had been prevented. The benefits of that should play out in the coming years with improved performance at school age. The results of this national program, which we understand to be the world's first national program, have shown that a multifaceted, multidisciplinary program introduced at scale across a nation can safely and effectively reduce the rate of harmful early birth. This program has been successful because it has been widely supported by the healthcare professionals. It has been warmly embraced by pregnant women and their families across Australia, and it has been supported by all levels of government, from the Minister for Health down to executive leaders of hospitals and to department heads. On behalf of all those who have been involved in this program, I extend our most sincere thanks to the government, to the hospital leads, and to the women and families of Australia who have made this work so effective. For many years, Australia has been one of the safest places for a woman to have a baby. This program has made it even safer.